So I'm going to talk about the anterolateral ligament. So we all know that ACL injuries are the most common injuries in sport, and about 1 in 5 elite athletes don't return to their pre-injury level. We know from the work in Australia that that's the case. It's still a career-threatening injury for elite athletes, and there's numerous papers that's been published on this, with rupture rates varying from 3 to 22%. The Stability trial that was done, I'd say fairly recently, was it's resulted in a significant increase in lateral extra-articular procedures around the world. I think the multi-centre nature of it, with a randomised control trial, has certainly led to that. And we already know the long-term outcomes of this. This is a paper from Bertrand and Leon that I did my fellowship with. And it was a match study with long-term outcomes with 104 months follow-up, with 86 isolated ACLs and 86 with an ELL. And you can see there's a odds ratio of 5 in terms of graft rupture with an ELL added. So the main question is an ACL rupture an isolated thing? And Adrian alluded to that with the ramp lesions, the ALL injury. And we can see from this video quite clearly, when you have an ACL injury, the anterior tibial translation causes the ACL tear, as we know, but it could result in a lateral root tear. And then that tibial internal rotation causes the anterolateral ligament tear in almost all cases. And then as that happens, you transfer to the other side of the knee, and the semimembranosus contracts, and that can cause an injury to your POL or cause your ramp lesions. This paper from Etienne Cavagnac and Toulouse quite clearly see here that there's only 24% of cases have an isolated ACL injury. And if you look at all the other things, ramp lesions, root tears, ALLs, you can see almost 2/3 of cases were reported to have an ALL injury. This paper I published 2 years ago now, and it was in professional athletes. It was looking at 342 pro athletes that Bertrand operated on. And it was a similar study to the long-term outcomes. You can see the overall percentage was 9% graft rupture, almost half was reduced with adding a lateral extra-articular procedure. You can see from this graph that the odds ratio was greater than 2. We're currently working on this paper that's also looking at the same cohort. And around 2012, we started knowing more about the ramp lesions at the back of the knee. We had meniscal repair techniques that were significantly better. And we're looking at that currently, and what we can see is that there's a massive reduction in terms of secondary surgeries in that time frame. So prior to October 2012, there was 30% of cases would have a secondary surgery. Since all these better repair techniques, awareness of the ramp lesions, awareness of lateral extra-articular procedures, we can see that it's almost half the number of secondary surgeries. So it's really a la carte type approach to it. This paper we published recently, and it was the ALL techniques from the Santi study group. First technique here is from Bertrand. This is his double bundle hamstring technique. So you can see there's 2 incisions in the tibia, one in the femur where his ACL graft comes through. He feeds the gracilis through, and he fixes that in extension to the ACL graft. This is Camilo Halito's technique from Brazil. So similar type of technique, except it's single bundle. You can see it's a single bundle technique. He uses a tunnel from the lateral side across to the medial side. The excess tendon from the ACL grafts fed through to that incision, and then it's brought through with a passing pin to the other side, and then that's secured with a screw on the other side. So that paper got an award actually at the ACL study group. But what about the internal brace in the ALL? So we published this paper in 2018, so 6 years ago now. And this is Gordon's technique. Hopefully it works. So we've got a swivel lock on the femoral side, so just posterior and proximal to the lateral epicondyle. It's tapped, and then the anchor is inserted with a folded over fibre tape. Similar incisions then made on the tibial side. The anatomical position is 22 millimetres from the Gerdy's tubercle on the line of the slope. We feed a suture through and then bring the fibre tape down to that position, and then that's secured with another swivel lock anchor. And Gordon does this in about 2-3 minutes. I've been in his theatre a few times and had a stopwatch, and he's very quick at it. So you can see it's a simple procedure. Adrian alluded to it in the last talk. Very straightforward. What about data for it? So 2020 we published this paper. This was an ACL repair cohort with 2-year outcomes. You can see there's significant improvements in all the PROM scores with a 5% re-rupture rate. And this was a younger, more active population that had a ACL repair with the ALL procedure. Following on from that, we presented it at the sports knee meeting, and we come up with this flowchart which essentially shows the different types of tears, and with repair, if repair is possible, then of course we can do that. In patients that are under 25, participating in sports, grade 3 pivots, then we'll be thinking about the ALL in that case. Patients that aren't suitable for repair, we would reconstruct with an internal brace. I'd probably safely say we've changed over the last couple of years, and both of us do an ALL for all ACLs now. Last year we published this paper. This was looking at a more hybrid technique. So this was ACL reconstructions with internal brace, but this didn't include ALLs. And you can see the results were fantastic. It was in the previous talk with a rate of 1.1% for graft re-rupture. And of course this didn't include some of the patients that had ALLs. So that's the next thing that we're currently looking at just now. We've got a cohort of 75 patients that we're looking at. It's still in the early stages of data collection and data analysis, but the data is looking pretty good, with a couple of patients having a re-rupture. That's in that younger, more active group, and this is a hybrid technique. So this is the BTB with the internal brace with a ALL internal brace. The take-home message is my family. Thinking outside the notch.